Thank you for spending a little time with me. I appreciate the opportunity to talk to you about COVID vaccination. It's a topic that is so very important, and I really am thankful for the work you're doing to serve our patients and clients, the impact that you have in our community. For those who've been vaccinated, I hope this gives you some information that you can use to help others make a good decision for themselves. For those who haven't gotten their vaccination yet, I hope we can talk about some of the science behind the COVID vaccination to bring you to a point where you feel a little bit more comfortable making that decision to get COVID vaccination. So we're going to start by going back to science class and talk a little bit about coronavirus. Coronaviruses are named for those protein-like projections that are on the outside. When you look under the microscope, it looks like it has a crown around it, which is what the name corona actually comes from, literally means crown. There are many types of coronaviruses, and we've been aware of coronavirus for some time. Sometimes it causes a mild respiratory infection. Other times it causes more serious infection. You may recall MERS, SARS, and most recently COVID-19. Viruses are small particles that can infect not only humans, but also plants and animals and cause disease. Coronaviruses are made of genetic material called RNA, and it's covered by a lipid layer and then those protein projections on the outside. When viruses make you sick, they enter the cell and they kind of hijack your cell and make your cell make more virus particles. And then those viruses spread throughout and infect more cells until you get to a point where your body's immune system starts to react and form a defense. And you also typically get to feeling sick. You start to have symptoms, in the case of coronavirus, loss of smell, taste. You may have fever, cough. And that's kind of the way viruses infect our bodies and use our cells to make more virus particles. And I've heard a lot of folks talk about, we have flu season every single year. Every year, unfortunately, people die of influenza, and this isn't any different. And unfortunately, part of that's true. We do have people that die every single year of influenza. The graph here on the right of the slide shows how we look at an epidemic every single year to see how it's impacting our community. You can see times when we've had more or less death associated with pneumonia, influenza, and most recently, the CDC added COVID-19. When you look at the experience that we've had over many years, looking at the right of this graph really starts to highlight what the difference is with COVID-19. Unfortunately, across the nation, we've been impacted differently by this. And so in some rural communities, they may not know anybody who has COVID. However, when this all got started, I was in Florida and I had multiple team members that had parents that died of COVID. So our experience with COVID has to do in part of the way that we travel, the density of our population. And so that can lead people to think COVID's not a big deal. But when you look at the numbers, it's been tremendous in the impact that it's had on our country. US COVID numbers add up to over 33 million COVID infections in the US and about 2.3 million hospitalizations. We have had over 600,000 deaths due to COVID-19 as of the date of this discussion. And it's a dramatic thing to think about because the last time I gave this talk, I was saying we've had almost 600,000 people die. And those numbers, the infections, the hospitalizations, the deaths, keep climbing with COVID-19. The COVID solution is vaccination. And we've had over 380 million doses of vaccine administered in the US. And we have almost 160 million people vaccinated with COVID-19. But we've also seen in the last few weeks that those numbers of vaccination have been slowing. And unfortunately, we've also noticed some troubling trends in our experience with COVID-19. So let's get back to vaccination. And let's start with, why do we vaccinate? Because if we can start there, my hope is we can start to lay the groundwork for us to look at vaccination a little bit differently. And we know from our survey that folks who are not getting vaccination oftentimes say it's because they don't understand the science, they think that it was rushed, they don't believe that it's safe. And so I really want to start to attack some of those elements so that we can start to go down the path with a shared foundation of knowledge. So we're going to go back to this picture a couple different times in our talk, because it really kind of helps us understand and frame up the difference between people who have never had infection and vaccination and those who have had infection and vaccination, and how that impacts our community. So on the left side, you can see each of the little blue people are susceptible to this infection. This is just an example. They're susceptible. Everybody who's red has been infected. So when you have somebody with an infection and they're surrounded by a bunch of people who have never had the infection and they've never had vaccination, your immune system, which fights infection, isn't ready, and it spreads like wildfire. And that's kind of what we experienced at the beginning of COVID-19. On the right side is what we're trying to push towards. You can see we still have infection, but a lot of the people around our little infected individual there are immune. And in this case, it's not saying whether they're immune from natural infection or whether they're immune from vaccination. And we'll talk about the difference there and how that impacts the individual. But you can see this infection doesn't have the opportunity to spread on the right side like it does on the left. And that's the basic heart of what we're trying to accomplish. And this is looking at it from a scientific standpoint. But the real reason that we vaccinate looks like this. It's how do we put ourselves in a position where the people that we love and that we care about have the safety to get together in groups and enjoy time together without being concerned about transmitting COVID-19. I don't know about you, but I miss Thanksgivings and Christmases and birthdays and just casual playing cards and getting together because of fear of COVID-19. I'm in a risk group that's relatively low, but there are a lot of people I love that would likely be at high risk of dying of COVID-19. And as I said, I had some colleagues that don't have parents because of COVID-19. It's a stark reality. It's hard to say. It brings us a lot of sadness, but it's the reality of why we're vaccinating. We're vaccinating because we don't want to get sick. I don't want COVID-19 any more than the next person. But I'm also vaccinating just as importantly because I don't want to give it to any of our clients. I don't want to give it to any of our colleagues, and that I have a family full of people that are advanced in age and may have chronic conditions that I love, and I do not want them to get COVID-19. And it is worth it to me to take this vaccination so we can enjoy being together again. So let's talk about how vaccines work. So when you look at the left side of this slide, it's demonstrating a couple of concepts that are important to understand how vaccines work. Our immune system is made of a number of different cells that contribute to fighting infection, but antibodies are a very important part of our immune process for us to understand when we consider vaccination. So on the top, you can see each of these different pathogens. And what it's showing you is pathogens like bacteria or viruses have little subparts that help us identify exactly what they are. That's called an antigen. And when our body gets an infection or a vaccination, they learn what that antigen or that subpart looks like. So when you look at this slide, measles, for example, on this slide is a little pointed triangle. And you can see the flu is the antigen is a little circle there. And the antibody that is being made is specific to that type of virus. And so when you build an antibody, either through getting infection or getting vaccination, your body develops antibodies that tell your immune system, aha, I've seen this before, and this is how we need to fight it. Our antibodies are kind of like those soldiers that work with the rest of our immune system to destroy pathogens and make sure that that response is really, really quick. The difference between the top and the bottom is you can form antibodies to infection. Sad part is you have to be sick to do that, but you can get antibodies that way. But it's much healthier and much preferred to get an antibody from a vaccine. You can see in the bottom, this is looking at that pathogen in green. Somebody who doesn't have any antibody, they don't have to get sick because we can show them that little bit of an antigen and they can form an antibody. And when they come into contact with that new pathogen, they're ready to go. And I'm going to talk to you a little bit about our immune response and why it's so important to get immunization. So look at the bottom right corner. This is an example. Primary antigen challenge is really science speak for the first time you get exposed to something that you've never had before. Think back to our little babies when you have those little kiddos and they seem like they're sick all the time. That's because they haven't been exposed to viruses and they're new to the world and their immune system needs to grow and learn. It's true babies get antibodies from mom's breast milk, but they still have a lot that their body has to learn. And they go through periods of being sick, as well as the vaccinations we give them to get their immune system strong. So when you look at the bottom right, that primary antigen challenge is an example of when you first get exposed to an infection you've never had before. And it takes, as you can see, about 7 days before you start making antibodies. And in that time, that's when you're feeling sick and doggone it, maybe you're missing work. In the case of COVID, it's very serious. Perhaps you end up in the hospital. Worse yet, you may die of COVID in that time where you don't have any antibody or you're not able to mount a strong immune system. The second antigen challenge there is an example of what happens once you get exposed to that the second time. And so if you get exposed to something that causes infection after you've had a vaccination, you go down that little axis to that second time, your response is robust. It's stronger than the first response. It happens the moment you get exposed. And again, you don't have to get sick. When you think about COVID vaccination has demonstrated over 99% effectiveness at preventing death from COVID. So when we think about over 600,000 US citizens that died from COVID-19, all those families impacted, you could prevent over 99% of that if they had just had the opportunity that we have today to get COVID vaccination. So how does the mRNA COVID vaccine work specifically? So mRNA vaccines are essentially little small piece of mRNA that's injected into the body through typically through your arm, your bicep there, and it's taken into your cell, and your cell uses it to make a spike protein. So when you look at this picture on the left, this person, the bottom part of where their arm is, that little light teal color, they're really showing you both those things we talked about. At the top, it's showing you what happens if you got the immunization. So you have that little piece of mRNA that's in that lipid nanoparticle, and it's being injected into your arm. The cell takes it in, and your cell makes that little spike protein. So you can see that little orange spike protein, and it's also showing your body making those antibodies. On the bottom of that light teal little circle, it's showing you what happens when you get the infection. You have an infection with that coronavirus, your body recognizes those spike proteins and is making the antibody. So you can see through vaccination, you're able to get the antibodies you need, but you don't have to get sick and you don't have to have the infection. When we think about mRNA, it's worthwhile for us to talk just a little bit more about that. Our cells use RNA for all kinds of different tasks, and mRNA is what's used to tell our cells to make specific proteins. Our cells then break down the mRNA. It's important to understand that mRNA is not taken into the part of the cell where your DNA is. I know some folks have a concern because DNA and RNA and starts to sound very confusing. And these pictures, even though they're cartoons, start to look a little confusing. Your DNA stays in your nucleus. On the picture in the right bottom corner there, the purple part is the nucleus, and your DNA is inside the nucleus. When your body is making a protein, it makes mRNA, and it sends the mRNA out into the cytoplasm, the area surrounding the nucleus, and that's where the protein's made. So when we take an injection that has mRNA, it doesn't mingle or come into contact with our DNA. It can't combine with it. It doesn't go into that part of the cell. It's not able to get there. What it does is it stays in the outside the nucleus, away from the DNA, and it helps your body make that spike protein. And then your body does what it does with all mRNA. Once it's done its job, it destroys it, it eliminates it, and it's gone. It's important for us to know just a little bit about that to kind of consider how these vaccines work. And a little bit later, I'm going to talk about the technology of mRNA vaccines and how long we've had experience. But speaking of that experience, we've had a tremendous amount of experience with vaccines. We have been using vaccines for over a century, and we have extensive knowledge of how they impact our body's immune system. We also have a lot of understanding of the types of side effects that are not uncommon with immunizations. It's very common for you to be a little sore in the arm, maybe have a little bit of a fever, feel achy after you get a vaccination. We see that with all vaccinations. COVID vaccine is no different than other vaccines in that way. Like I said, thinking back to those babies, it's not uncommon when they get their 2-month shots for them to be fussy. They may have a little bit of fever, but again, we're putting them in the position to where they don't have to get measles, they don't have to get chickenpox, they don't have to get those things that are vaccine preventable illnesses. We don't have to endanger their life or put them at risk of serious side effects of serious illness. We also know from all this experience with vaccines that long-term side effects of vaccines are unlikely. We typically see vaccine side effects within 6 weeks of the vaccination, and COVID-19 is no different. The serious side effects that we've had with the COVID vaccine, and I'm going to talk about that a little bit later, have been very rare, but they've happened within that 6-week time period. And when we first started with COVID vaccination, we had thousands of people that were in those clinical trials. And we understood what kind of side effects folks had, like the sore arm, maybe their arm turned a little red, they may be a little achy. But at this point, we have millions and millions of people who have had these vaccines. And we have the most aggressive safety monitoring for vaccination that we've had in US history. Not only do we have the vaccine adverse event reporting system that has been in place for some time, we also have Be Safe and many other ways that we are monitoring how vaccines are being tolerated, if we're having any side effects, and of course, how effective are we seeing them in our communities. So let's talk a little bit about mRNA technology, because this is a hot topic, and I think is an area that is worth investing a little bit of time so you really know the history, not only so you can be comfortable with where we're going with this vaccination, but also so you can be proud of the accomplishment of our scientists. So there's a common misconception that this technology is entirely new. And that's not true. Our scientists have been working on RNA technology for decades. This is a timeline that kind of lays out some of the important points. And one of the things you'll see on it is about 11 years ago, the team began working on mRNA and lipid nanoparticles that led to the collaboration with BioNTech and Pfizer. If those names sound familiar, it's because those are the companies that received the first emergency use authorization from the FDA for COVID vaccine. In fact, when you go and get your Pfizer vaccination, these are the companies that discovered that and are producing it. Their work set us on the path to be ready for this fight. But it started a long time ago. Another important detail to point out along the way, and again, I love to see those scientists in the lower right corner. As you see Dr. Corbett down there, in 2014, Dr. Corbett, in response to SARS and MERS, started studying the spike protein and considering how the spike protein could play a role in developing coronavirus vaccine. So you can see how our scientists were working to figure out how do we use mRNA and what needs to happen with the lipids so that we can get them into our cells. And then how could the spike protein help us defend against coronavirus? All of that work was taking place. And then you fast forward to our new novel coronavirus, and all of those scientists diverted their attention away from what they were working on immunizations for things like influenza and Zika. All that work stopped and shifted over to coronavirus. So you can see this all set the stage. When people think about this mRNA vaccination was discovered and created in less than a year, It's simply not the case. It's been decades of work, and we're fortunate, and I'm very thankful and proud of those scientists. I got my vaccination back in December of 2020, and it was a moment of pride that I had not only for our scientists and their life's work, but also a moment of pride for our country and the powerful step we were taking forward in our fight against COVID-19. COVID-19 vaccines are safe. As I mentioned, they were evaluated in thousands of participants in clinical trials. All of our vaccinations that are available went through that rigorous scientific process, meeting the standards for emergency use authorization by the FDA. And now we have over 380 million doses administered. We have had the most extensive safety monitoring program in US history related to COVID vaccination, ensuring that they're safe. But we know every therapy and advance in healthcare comes with some risk of adverse side effects. COVID vaccination is no different than other areas of healthcare. And although they are extremely rare, we have identified 3 serious types of health problems associated with COVID vaccination. The first of these is anaphylaxis. This is a very serious and sudden allergic reaction that can be life-threatening if not treated. This is a potential side effect of any medication, and for some individuals, this can even be caused by certain foods like peanuts. We know how to treat anaphylaxis, and your care team will be monitoring you for any signs or symptoms you may have of anaphylaxis. And this is why you must wait 15 minutes after your immunization. We're making sure that you're tolerating it and that we don't need to treat you any further. We've also discovered a very rare potential for thrombosis with thrombocytopenia syndrome, also called TTS, after vaccination with J&J and Janssen. This is a very rare, serious health adverse outcome. It occurs about 7 per 1 million vaccinated women, and it's in women who are aged 18 to 49. And so this is one of the things I'd like to highlight about our safety monitoring. We found a situation, an adverse event that happens 7 out of 1 million doses. That's a heck of a needle in a haystack, but we're monitoring, and physicians are required to submit when there's a serious outcome as a result of a vaccine. We're also, as I mentioned in the previous slide, you have the opportunity to sign up and monitor your symptoms and report it to the CDC, and many people have done that. Finally, we've also identified a slight risk of myocarditis and pericarditis in children and young adults. And I want to talk a little bit more about that. So myocarditis is inflammation of the heart, and pericarditis is inflammation of the lining outside the heart. In the case of vaccination, it is the body's immune system causing inflammation in response to some trigger. Symptoms include chest pain and shortness of breath, and it occurs about 7 days after the second dose. Children and young adults should see their doctor if they have any of these symptoms following either Pfizer or Moderna vaccination. In most cases, patients recover completely from myocarditis and pericarditis. We know how to treat this type of inflammation. The information on the right of this slide gives details specific to the number of cases and their outcomes at the time the ACIP reviewed the information and confirmed the increased risk. However, the CDC, American Academy of Pediatrics, and many other associations and physicians, including myself, recommend children and young adults still get the vaccine. So let's talk about why physicians are recommending this vaccine when we know there is this rare risk that some patients may develop myocarditis or pericarditis. Our scientists look at the data in terms of benefit versus risk. This is how the experts and scientists review the information. The CDC estimates for every 1 million second doses in females ages 12 to 17, we could prevent 8,500 cases of COVID compared to the risk of 9 cases of myocarditis or pericarditis. For every 1 million second doses in males ages 12 to 17, we could prevent 5,700 cases of COVID for a risk of 63 cases of myocarditis or pericarditis. This slide shows potential infections prevented in each age group compared to the risk of myocarditis and pericarditis. Although the risk is very low, it's very important for us to talk about that risk and for people to be aware. Because after the second vaccination, you need to be monitoring for symptoms that we discussed on the previous slide. Most of them occur within 7 days, but you really want to monitor for symptoms up to 2 weeks. So why are we willing to accept any risk? Because the risk of COVID far outweighs the rare risk of vaccination. Pandemic to date, we have had 7.7 million people ages 12 to 29 diagnosed with COVID-19, and 2,767 have died of COVID. We've also diagnosed 4,000 cases of multi-system inflammatory syndrome in children. Those statistics are a stark reminder that we have over 2,700 families who have lost a child or young adult due to an illness that we can now prevent from causing death in nearly 100% of the cases. It is difficult to consider, and it is very hard because the science gets heavy, but it's important that we take the time to really think about what we're working towards. What do we expect these vaccinations to prevent? I have a family of 4 kiddos in this age group. My youngest is 12 and my oldest is 21. All of my children fall into this group that we're talking about, and all of my children received vaccination. My son got Moderna, and my other 3 girls all received Pfizer. It's just what was available. So if you wonder what I would do for my own family, that's it. I would vaccinate. But more important than what I would do, look for yourself. All of this information is available to you on the CDC website. You can see the actual cases and data that inform this recommendation. So let's talk about who made this recommendation. My entire career, I have been using ACIP as a guidance for my immunization practices. So what is the Advisory Committee on Immunization Practices? Although ACIP may not be familiar to you, they have been impacting your healthcare and the healthcare of your children since 1964. They have been writing the rules literally my entire life. They have 15 voting members, and then there are a number of other associations like the American Academy of Pediatrics, American Academy of Family Physicians that play a role. They are non-voting, but they represent big groups of physicians and other stakeholders. But I wanted to give you everybody who's actually on the ACIP committee, because I think these recommendations start to feel impersonal. They start to feel like there's a think tank in the Northeast somewhere that just says this is what we should do. But actually, interestingly enough, 2 of these ACIP committee members are from our backyard. We've got an OBGYN doc from the University of Kansas who serves on this committee, and there's also a physician who is the director of vaccine development from St. Louis University that serves on this committee. The expertise is diverse. As I mentioned, they're all physicians and they come from all over our country: Georgia, Missouri, Kansas, Washington, California, Ohio, Tennessee. You can see down the list there. But the other thing I wanted to kind of talk about, and I ask you to consider, for the first time that I can remember, other than maybe Gardasil and HPV, which is another type of vaccination, but in large part, this is the first time I've seen vaccination become a big political debate, and where we've really started to challenge and question, and in some ways not trust these groups of physicians that volunteer their time and are experts in their field and just want to review the evidence and give us recommendations on how we optimize our health. And when you think about the political landscape, I want to just make sure that everybody watching this understands and considers, although this has become somewhat of a political debate for some folks, our first vaccination was approved and developed during President Trump's presidency. So when you think about the transition that we've had between President Trump and President Biden, and regardless of who you were voting for and who you feel like would lead us in the right direction, this vaccination was approved before that transition ever happened. And interestingly enough, By far, the vast majority of the committee members that had made the decision on COVID vaccination recommendations were in place before that transition. 12 out of the 15 members joined the committee during President Trump's presidency. So we're going to talk a little bit later about misinformation and how we get confused and how we get our eyes off the main point. So one of the things I would ask you is think back on the physicians who have, and nurse practitioners and physician's assistants and all the clinicians who have worked with you to help you accomplish well-being and accomplish your healthcare goals. And then consider a room full of those physicians, them looking at the data and trying to give you their best recommendation. That is exactly what the ACIP is. I trust them wholeheartedly, and I've followed their recommendation my entire career. So what's in this vaccine? I kind of like these pictures. This makes it pretty darn simple. As I said, you can look a lot of stuff online, and you can find the exact components of each of these vaccines. But at the end of the day, it comes down to mRNA, salts, lipids, and sugars for both Pfizer and Moderna. And when you look at the bottom lower corner, it's kind of showing you what type of things we use every day that have the same types of salts, lipids, and sugar. In fact, the only thing that's really different is that mRNA. That's the element that you can't find in other things that you use every single day. So these are very transparent vaccines, and you can find exactly what's in them, and they're listed at the top left corner of the slide. But if that's something that's bothering you, and that's the worry, well, I don't know what's in this vaccine. You know, it's right here, and you can look every single one of them up, and you can kind of figure out, okay, what other things am I using or eating and ingesting that have this exact same compound? So I want to shift over and talk a little bit about variants. What are they? Viruses are constantly changing. I think we talked about coronaviruses are RNA viruses, and then we also have DNA viruses. RNA viruses are more likely to mutate in compared to DNA viruses. Coronavirus is an RNA virus, so the fact that it's mutating and changing is not a surprise. And when you think about a mutation or a variant, it's something that changes an element of the virus. And sometimes that doesn't make a bit of difference. Sometimes it makes it more easy to transmit to other people or spread. Sometimes it makes the infection more severe. And so that's why we care about variants and why there's so much discussion. Think about a virus as a tree growing and branching out and changing. Each branch of that tree is slightly different, and that's what we're seeing with variants. When you think about COVID variants, we have an agency a committee, in fact, that has identified different classifications of variants. So we look at those variants of interest where we're not quite sure the significance of that slight change. Variants of concern means we think that there's likely an increased risk of infection. So that variant has changed the virus in a way that's significant. And I'll tell you about that on the next slide. A variant of high consequence is a variant with clear evidence that prevention measures or medical countermeasures have significantly reduced effectiveness. So the things that we've done, vaccination, treatment, previous infection, the impact and the protection of those things will not be as effective against a variant of high consequence. In the US, we don't have a variant of high consequence yet. We do have variants of concern. And so the US government SARS-CoV-2 interagency group is the committee that classifies these types of variants. And the variant of concern, as I mentioned, has evidence of 3 types of impact. So there are 3 ways a virus can be recognized as a variant of concern. One way is when the virus changes in such a way that it makes it more difficult for us to diagnose or treat it. So our tests are not picking it up the way they were before, or our different treatments in the hospital, or our vaccinations, antibodies that we have from natural infection. Those ways that we diagnose and treat aren't working as well against that virus. And that's a way that it becomes recognized as a variant of concern. If the virus change causes it to be more easily spread between people, that's another way it may become classified as a variant of concern. And finally, if the changes in the virus result in the virus causing more severe illness or disease, that is another way it can become recognized as a variant of concern. And again, information about variants is all available on the CDC website. And for me, that's my go-to source. If I want to know about COVID and what we're learning about the virus, I go to the CDC. And it's interesting talking about variants because variants have really put Missouri on the news cycle in a way we don't want to be. This is from a couple of weeks ago. The first time I was giving this talk, all of this just kind of blew up. And they were recognizing that Missouri had the Delta variant and that we were seeing high levels of spread. So I wanted to kind of share this to help explain why that variant is important and talk a little bit about the way we look at variants. When your doctors and providers are talking about variants, here are the things that they're thinking about. So the way we talked about variant of concern, transmissibility, severity of illness, how does the antibody work? You can see we've got alpha variant at the top right. There's the little table there. We've got the alpha variant, the beta variant, the Delta variant, and the Gamma variant. You can see Alpha was first identified in the UK, Beta was first identified in South Africa, Delta was first identified in India, and Gamma was first identified in Japan or Brazil. And on the bottom right, I just pulled this off of the CDC website. You can see the portion of our COVID cases that are being caused by the different variants. And the interesting thing is when you look at that far right, the far right is the entire US. And the bar that's on the far right of the far right is from June 19th, looks like, or maybe, yeah, June 19th. And you can see that dark orange bar is Delta variant proportion. Now look at the next bar graph, the one that says HHS Region 7. Missouri and Kansas are both part of Region 7. Look at our 619. On June 19th, our orange bar or Delta variant was over half the cases of COVID. And so it starts to give you and our scientists and our physicians and our ER docs and our hospital docs a real clear picture of why did Missouri at that time look much worse than the rest of the nation? Well, we were really being impacted by Delta variant. And what we know about Delta variant is it spreads more easily. The other thing we know in Missouri, and one of the reasons why this discussion is so critically important, is that we know our vaccination rate is significantly lower than the rest of the country. And the thing that I think is really unfortunate is our vaccination rate is lower in areas where they may not have had as much firsthand experience with the last COVID spike. When you compare Missouri to places like New York and Florida, they were impacted significantly harder compared to just total numbers in Missouri. And so you kind of see kind of a perfect storm where we have a very easy to transmit variant in a state that may not fully appreciate and recognize the dangers of COVID, and they've chosen not to vaccinate. So there couldn't be a more important time to vaccinate. And as we talk about the science here, it's interesting with the Delta variant. So we're looking at all kinds of different areas of the virus to see how they've changed. The Delta variant has a mutation on its spike protein, and that specific mutation has been shown to increase viral spreading, which makes it more easy to spread infection. That mutation has been associated with increased infection severity, and it's also been associated with reducing antibody neutralization. So when you think about our antibodies are really what helps our immune system fight infection, this is a variant that has been shown for our antibodies to maybe not be as strong against them. And when we looked at it, natural immunity, so people who had previous infection, there was a 4 to 6.7 fold decrease effectiveness of their antibodies associated with this mutation. compared to a twofold decrease against immunized antibodies. So in the case of this mutation, it would certainly appear there are folks who say, well, I had COVID 6 months ago. I don't need an immunization. In the case of this mutation, it would be very important to get your immunization because the immunization is holding up or working better against this variant than natural immunity. But all of this is changing, and our scientists are looking at it. And when you look at the numbers overall, our vaccination holds strong and prevents greater than 99% of death from COVID. So we're going to continue to see variants. We're going to continue to monitor them and see how they're impacting the way we experience illness. And there's lots of good information out there, but this data really supports the importance of immunization, even for those folks who have had natural infection and have developed antibodies in response to that. So how do we stop the variants? Because we know that in many cases they're easier to spread, they cause more severe illness. Sometimes our treatments don't work against them. The only way to stop the variant is to stop the virus from spreading, to get vaccinated. When you look at that, going back to that first picture we started with, if that virus doesn't have the chance to spread to another individual, to another person, it doesn't have the chance to change. And so the only way we can stop variants is by getting vaccinated and stopping the spread of COVID. And I wanted to kind of bring this up and kind of think back. So what would be the impact of our vaccine right now? We know our vaccines to be around 95% effective at preventing COVID infection. So when you think about this picture that we've continually looked at, there are 19 people on this. 95% immune would leave only one person on that could get COVID-19. And that is how we stop the variants. That is how we serve our community, and that's how we beat COVID-19. So I want to talk, we're just about done here, but I want to talk a little bit about a common concern, and it's vaccination and fertility. And kind of thinking about how do we invest time in our health and in the health of our communities in a way that help us understand how important vaccination is. There's so much information out there. You can get to the wrong site. I recommended the CDC as a great place to go. It's my first place to stop when I want to know about COVID. However, if you're a woman who's pregnant or considering getting pregnant sometime in the future, a great place for you to stop is ACOG, the American College of Obstetricians and Gynecologists. They have, it's obviously an association of OBGYNs that have devoted their careers to serving women and families and are so very invested in the health of moms and babies. And this is what they had to say about vaccination and fertility. And I'm going to read it exactly like they say it because it's so important. And I would encourage you to go and read what they have to say. Don't take my word for it. Go and see what ACOG says about vaccination. Vaccination is strongly encouraged for non-pregnant individuals. Further, ACOG recommends vaccination of individuals who are actively trying to become pregnant or are contemplating pregnancy. Additionally, it is not necessary to delay pregnancy after completing both doses of the COVID vaccine. Claims linking COVID-19 vaccination to infertility are unfounded and have no scientific evidence supporting them. They went further to say pregnant moms should have access to vaccination. And as of June 7th, 2021, there have been 123,000 pregnancies reported to the CDC on the vSafe post-vaccination health checker. ACOG was a passionate advocate for pregnant women being included in the study because we know that pregnant moms have a higher risk of preterm labor and other adverse outcomes if they get COVID during their pregnancy. And it's for this reason that ACOG says if you're considering pregnancy, anytime in the future, you should get your vaccination. All women should get their vaccination, but particularly women who are planning to become pregnant, because if you get COVID during your pregnancy, you're going to have a higher risk of adverse outcomes of that pregnancy. And for pregnant moms, they recommend that pregnant moms should have access to vaccination and they should talk to their doctor about what we know about COVID vaccination in pregnancy. The only reason that ACOG doesn't strongly recommend vaccination in pregnant women is because they weren't included in the study. If they had been included in the study, we'd have the information. So they recognize that. Although there is no evidence to show that vaccination causes infertility, it highlights the power of fear and misinformation. This all started as an internet myth based on the concern that because the spike protein had a very small piece of genetic code that was the same as a placental protein, perhaps your body would get confused. However, it is a very small section, and I like the way one physician put it. The idea that your immune system would get confused and mistake a placental protein for a coronavirus spike protein is like confusing an alley cat with an elephant because they're both gray. It just isn't going to happen. But we went further. There was a team of scientists that examined 3,000 different types of human proteins, including the placental protein, to test how antibodies that were created in response to infection or vaccination might react to those proteins and mistake them for a coronavirus. And what they found is that none of those proteins had any reaction to the antibodies formed by coronavirus infection or vaccination, including the placental protein. So not only does it not make sense from a scientific standpoint, but we've proven it in the lab that this is a myth without any validity. And ACOG has gone out very strongly against it, saying this absolutely is not the case. But it is a myth that has really made it very difficult for young adults to make this vaccination decision. And I encourage you to share this information with anyone you know that's avoiding vaccination because of this internet hoax. So I want to go into the importance of our words. Our words have weight, and we have to stop the misinformation. I ask you, as you hear some of these things that just don't make sense, that there's a microchip chip in the vaccine, or you get this vaccination and you're going to be infertile the rest of your life. Any of these things that just don't make sense. You've gotten lots of immunizations in your life. It just doesn't connect with your experience from your physicians, from your own personal life. Take a break. Take a step back and look at sources like ACOG, CDC. See if you can confirm that misinformation. And if you cannot confirm that misinformation, be the person that stops. Don't forward that information on. Don't share it. Recognize, do your own research, check the source, become a citizen investigator. Like I said, I enjoy looking at all this science and looking at all these outcomes. You can do it too. Get out there and read. Look and see what are they saying? What's ACOG saying? Look at the research. It's all available to you. And when you find that misinformation and you have an opportunity, correct it. Be careful because this is a topic that's pretty, can be a little bit of a trigger topic for folks. People get upset about this topic and there's a lot of misinformation. So go gently into those conversations. But I firmly believe it's not going to be a health system. It's not going to be a political party. It's not going to be a news anchor that gets folks who are afraid of vaccination more comfortable. It's going to be a friend, a family member, hopefully a provider, somebody who has spent some time with them. It's going to take all of us kind of combating the misinformation, sharing what we know, sharing our own personal why, our story. It's going to help people get where they need to be. I wanted to leave by simply recognizing what a very difficult year it has been with a tremendous amount of change and loss. We are all tired of hearing about and thinking about COVID. We've had our fair share of uncertainty, and we've all lived with fears of the unknown. However, we have the opportunity to take our normalcy back and protect our friends and family. We have a vaccination that nearly eliminates your chance of dying from COVID at a time when we have had over 600,000 Americans die due to COVID-19 and so many more worldwide. I ask you to think back to those pictures of families and friends getting together, enjoying their time, and consider that courage is not the absence of fear, but rather acting in spite of it. Think of the things that we're willing to be courageous for, because now is the time. We must be brave. We must engage in this discussion and share real information and resources that help take us the next step forward in not only moving ourselves to vaccination, but moving those around us to vaccination. I'll end with my wild crew here. I think it probably speaks for itself. I've got a great niece and great nephew that are in there, but all the blondies are my group. And so when I'm talking about my 12 to 21-year-old span, that's the group. And right there in the middle is my 77-year-old mom. And that was us celebrating her 77-year-old birthday. And so when I think about COVID and my why is for all of you, everybody I work with, everyone that I care for, my community, and most important in my heart is this picture, this picture of people that I love, that are important to me, and that I want every single day I can have with. And I want us to have the confidence of being together and beating COVID-19. So thank you for spending some time with me to discuss COVID vaccination. It is a topic that is so important. And for those of you who are vaccinated, I hope you can use some of this information to encourage those around you to get vaccinated. And for those of you who have not gotten their vaccination, I hope we hit on some of the topics of interest that allow you to consider your hesitancy and take this important step for your health and the health of those around you.